just kind of pausing, there's so much to unpack in what you just said, but one that really strikes me is just the user experience. I think way back when 10, 12 years ago, we had, everybody was launching patient portals, provider portals, and there was this kind of sense of patients and providers don't want portals. And it's kind of been like stigmatized. And what we've seen is that the reality is that most of those weren't effective, they weren't useful, or they just had really clunky user experiences. So it wasn't that the patients or the providers didn't want those tools, they just needed a higher quality tool in order for it to actually be useful for them. And it sounds like part of what you'll be doing is helping to elevate that.
And we'll figure out the problem you're trying to solve. And was that the problem, or were they looking at the solution first? So ask the right question before you get to the answer. Sometimes we start with the answer because we assume what the question is. And so often that's the case. Or we're trying to solve a problem that doesn't exist. So it's really important that you unpack, why you're doing what you're doing in that way. And we do know, we just run a survey here, and we do know that patients absolutely embrace digital health. In fact, 67% of people in the UK believe that digital health will help alleviate the pressure on the healthcare system. And over half, not half, just up to half of people have actually used a digital health app in the last year. And 83% of them found it helped their health. So people want it, people embrace it, and people use it, and it benefits them. So it's about making sure that we provide the right solutions at the right time.